The dawn of injectable weight loss. A new hope? A new class of drugs has taken the world by storm, promising significant weight loss through simple injections. These medications, known as GLP-1 agonists, include popular names like Ozempic, Wegovy, and Mounjaro. Many people struggling with obesity see them as a miraculous solution, a way to finally shed pounds that have resisted diet and exercise for years. Patients have reported losing substantial amounts of body weight, sometimes up to 20%, fueling a surge in demand and widespread media attention. These drugs work by mimicking a natural hormone in the body called glucagon-like peptide 1. By activating GLP-1 receptors, these medications slow down how quickly food leaves the stomach. This leads to a feeling of fullness that lasts much longer than usual. They also signal the brain to reduce hunger and food cravings. The convenience of an injection, compared to the perceived difficulty of sustained lifestyle changes, adds to their attractiveness. However, as with many medical breakthroughs that seem too good to be true, a more complex picture is beginning to emerge. It is crucial to look beyond the headline figures of pounds shed and delve deeper into what these medications truly mean for overall health and well-being, particularly as their use becomes more widespread. Whispers of warning. Doctors raise concerns for the vulnerable. Amidst the widespread enthusiasm for GLP-1 agonists, a growing chorus of concern is emanating from the medical community. Doctors and researchers are beginning to issue warnings about potential risks that may not have been fully appreciated during the initial rush to embrace these drugs. The primary worry centers on the impact these medications might have on specific groups of patients, particularly those who are already at risk for other health complications. The elderly and frail are at the forefront of these concerns. For them, any intervention that could exacerbate these vulnerabilities requires careful consideration. Doctors are increasingly questioning whether the aggressive weight reduction promoted by GLP-1 agonists is universally appropriate. The medical community is urging for a more nuanced approach to prescribing these medications, moving beyond a one-size-fits-all mentality. Medical professionals are calling for greater awareness among both prescribers and patients regarding these emerging risks, emphasizing that the decision to use these medications should be made with a full understanding of all possible outcomes. The unseen toll, when weight loss means more than fat. One of the most significant concerns emerging about GLP-1 agonists is the nature of the weight that is being lost. While patients and doctors alike celebrate the reduction in numbers on the scale, it is crucial to understand what those numbers represent. The ideal scenario for weight loss is the shedding of excess body fat while preserving or even increasing lean muscle mass. However, research is beginning to indicate that this is not always the case with these popular injectable drugs. The body, under the influence of these medications, may not discriminate effectively between fat stores and other vital tissues when it rapidly loses weight, leading to unintended consequences. Some studies and reports indicate that up to 40% of the total weight reduction may be attributed to a loss of vital muscle and bone mass. Losing muscle is fundamentally different from losing fat. Muscle tissue is metabolically active, contributes to strength, mobility, and overall metabolic health. When these critical tissues are diminished, the benefits of weight loss can be significantly undermined by new, potentially serious health problems that were not part of the initial equation. Understanding this unseen toll is vital for making informed decisions about weight management strategies. Muscle matters, the erosion of strength and stability. Sarcopenia, the loss of muscle mass, has significant consequences, especially for the elderly. Muscle is essential for movement, balance, and daily tasks. GLP-1 agonists can reduce muscle, impacting functional capacity. Everyday activities like climbing stairs or carrying groceries become challenging. This erosion of strength affects independence and quality of life. Impaired strength from muscle loss is a primary concern. Weakened muscles reduce the body's ability to support itself. This can lead to further health problems. Reduced muscle mass increases the risk of falls. Weight loss interventions must preserve muscle integrity, especially in the elderly. Section 5. The silent thief, bone density, and the looming osteoporosis crisis. Beyond the detrimental effects on muscle tissue, the use of GLP-1 agonists for weight loss is now linked to another serious concern: the reduction of bone mineral density. Bones are living tissues that are constantly being broken down and rebuilt. When weight loss is rapid and significant, as is often the case with these injectable medications, it can disrupt this delicate balance. The body, potentially under nutrient stress or hormonal changes induced by the drug and weight loss, may not rebuild bone as effectively, leading to a net loss of bone mass over time. This reduction in bone density significantly heightens the risk of developing osteoporosis. Osteoporosis is a condition characterized by porous, brittle bones that are highly susceptible to fractures. For individuals taking GLP-1 agonists, particularly older adults who may already have some degree of age-related bone loss, this added risk is a serious consideration. The prospect of trading excess weight for an increased likelihood of debilitating fractures is a trade-off that requires careful evaluation and open discussion. Section 6. Expert alarms medical professionals speak out on fat jab dangers. The growing unease surrounding the musculoskeletal side effects of GLP-1 agonists is not mere speculation. It is being voiced by respected medical professionals and organizations. Julia Thompson, a specialist nurse associated with the Royal Osteoporosis Society, has highlighted the emerging nature of this research. She emphasizes that individuals considering these drugs need to be explicitly warned about the potential for losing bone and muscle mass alongside fat. Professor Carl Hennigan, the director of Oxford University's Center for Evidence-Based Medicine, offers an even starker warning. He states unequivocally that any drug that reduces muscle mass and bone density is a bad idea for people who are frail and those vulnerable to fractures with osteoporosis. Dr. Tahir Mahmood, founder of the London Osteoporosis Clinic, echoes the need for proactive measures, stressing that it is essential that those taking GLP-1 agonists know about the importance of good nutrition and weight-bearing exercise. This highlights that if these drugs are used, they should ideally be part of a comprehensive plan that actively seeks to mitigate the risks to muscle and bone health through supportive lifestyle interventions. Section 7. A gendered risk: why postmenopausal women face greater peril. While the risks of muscle and bone loss associated with GLP-1 agonists are a concern for all users, certain demographics face a heightened vulnerability. Women, particularly those who have gone through menopause, are at an intrinsically higher risk of developing osteoporosis. This pre-existing susceptibility makes the potential bone-thinning effects of these weight loss drugs an even more pressing issue for this group. The primary reason for this increased vulnerability in postmenopausal women is the significant decline in estrogen levels. Estrogen plays a crucial protective role in maintaining bone density throughout a woman's life. When estrogen levels drop sharply after menopause, this protective effect is diminished. Therefore, when a postmenopausal woman starts taking a GLP-1 agonist for weight loss, she may be unknowingly compounding her risk for significant bone density reduction. Section 8. Informed choices: the crucial role of medical guidance and lifestyle. The decision to use GLP-1 agonists for weight management must be informed, considering potential muscle and bone loss. Patients need clear, unbiased information to understand both benefits and risks. A thorough consultation with a healthcare professional is essential. This ensures the treatment plan aligns with the patient's health goals. Section 9. Beyond the scale: demanding prudence and deeper understanding. While GLP-1 agonists like Ozempic, Wegovy, and Mounjaro undoubtedly offer a powerful tool for inducing weight loss, it is increasingly clear that their benefits must be carefully weighed against significant emerging risks. The allure of shedding pounds quickly can be strong, but the potential cost in terms of lost muscle and bone mass, especially for the elderly and frail, demands a more cautious and discerning approach from both the medical community and patients. The conversation must shift from a singular focus on the number on the scale to a more holistic view of health, considering body composition, functional strength, and long-term well-being. The dangers of circumventing proper medical advice cannot be overstated. There is an urgent need for more comprehensive, long-term research into the effects of GLP-1 agonists. Ultimately, the path forward requires a commitment to prudent prescription practices and a personalized approach to patient care. As our understanding of these fat jabs evolves, the medical community must prioritize patient safety and long-term health outcomes over the seductive simplicity of rapid weight loss, ensuring we do not inadvertently create new